The United States of America is one of the countries that has been affected and is still being affected significantly by the COVID-19 pandemic.
The United States is approaching 200,000 coronavirus deaths. How has it been dealing with the situation?
All right, joining us now via Skype to discuss this is Dr. Emilia Iwu, President, National Association of Nigerian Nurses in North America. It's good to have you, Dr. Iwu, join us right now, and thanks for staying up to discuss this issue.
All right, thank you so much. Thanks for having me.
Thank you so much. Now, make us understand basically the peculiar situation of what patients and even those of you who are health workers are going through, seeing that the United States has the highest number and has consistently maintained the country with the highest, or being the epicenter of COVID-19 in the world right now.
Yeah, so I'm going to speak on from the perspective of a nursing organization. You know, we have a National Association of Nigerian Nurses in North America, and this is an umbrella organization that is, you know, we have about 20 chapters from different states. So at the beginning, with the epicenter in New York, it was very, very critical for healthcare workers. Many of us did not have any personal protective equipment to work with. We had to really identify and respond to the needs of our members who have to go to the front line every single day. You know, so many of us were very extremely fearful to go to work. It was very, we were very anxious. And this was coming from the fact that, you know, there's a risk of infection for healthcare workers, especially nurses who are in the front line 24/7. You know, the workload is still very high. The number is getting lower and lower, but in many states, the numbers are going high. So when this is going on, many of the units or the wards are converted to 100% COVID units. So that increases the workload, as well as, you know, at the end of the shift, many nurses are very tired.
Now, that's where I'd like to pick my question from.
Yeah,
the impact of the long hours and of work and the strain and stress, the fear that you have mentioned, because there has been reports saying that a lot of those on the front lines have faced depression and all of those mental health challenges. Talk to us.
Absolutely.
What happens or what happens? Yeah.
So, you know, oftentimes, you know, when you have the number of patients we are taking care of increases, and then we see more patients dying, and a lot of that takes a toll on the mental health of healthcare providers, especially nurses. Many of the nurses were reporting that many of them see in 1 week a higher number of deaths than they have seen in their career. So because of that, it puts a lot of mental health strain on us. I remember in the earlier phases when our nurses were many of them were very anxious. They don't want to go to work. A lot of our families members were afraid that we will contract the disease and die from it. So it's a lot of pressure, not only from the work, it's also coming from your family who have very high concern about you being alive to take care of them. So we have had a lot of psychological issues. Many nurses will come home, they cannot sleep, and they will call in the middle of the night and asking for support. So what we did as an organization was to start a daily support group for our nurses. We were all calling on phone for 1 hour every single day in the evening to support nurses, have them talk about their day, have them vent to people, other colleagues who can understand what they're going through. So many of us were coming home from the same kind of work environment. And the fear of not having protective equipment at the beginning was really what drove a lot of the anxiety too. Because if you are very safe in your environment of work, and you can be able to relax and take care of your patient the best way you know how, you know. So that daily support group has been very helpful to many of us. The other thing that we did was You know, and Nigerians, we don't like to talk about our issues in the open. Sometimes a lot of the nurses who became infected didn't want to come out in the open to talk about these issues. So we developed a peer support group where those who have recovered will call them and, you know, give them support at home on at individual level.
Okay, Dr. Iwu, before we let you go, can you share with us how people are responding and reacting to the safety protocols that are on ground? How are people complying with them or otherwise?
Well, you know, yesterday, the CDC director came out on the news and was encouraging every American to use mask. That has been a challenge because, you know, here, people like to exercise their personal freedom. So majority are wearing masks, but some people do not want to wear masks. So, but the Center for Disease Control is really trying to encourage Americans to make sure that they wear masks because evidence shows that it really prevents the virus from infecting other people. A lot of the protocols, many of us are taking care of it. I can tell you from our own organization, we have not recorded any nurse dying from complications of COVID. And we kind of give credit to the fact that, you know, over time we have all this protective equipment that we're using. People need to use those things because they do protect, prevent infection from going from one person to the other. You know, so that has been something that a majority are complying, but some are not. But then, you know, you can't force them to do it.
Yeah. All right. Thank you so much, Dr. Amelia Iwu, President, National Association of Nigerian Nurses in North America. Thank you for staying so late to speak to us on TVC Breakfast this morning.
Thank you.
And thank you for having me.
Thank you.
Have a good day.
All right. Bye now.